Good afternoon, everyone, and welcome to day 3 of Community College Week and our second day of Allied Health. My name is Nikki. I'm in the Recruitment and Outreach Department, and I'm here with our faculty members of our Respiratory Therapy Program, and they're going to tell you all about our program today. If you're following with us on Facebook, put in the comment section any questions you all might have. If you're here in the meeting, you can feel free to type that in the chat, and I will hand it on over.
Hi, welcome. My name is Renee Randall. I am the program director for the Respiratory Therapy Program here at Delgado. And Mavis, I'll let you introduce yourself.
Hi, I'm Mavis Larimer. I'm the director of the clinical aspect of the respiratory program here at Delgado.
So we wanted to share with you guys that are joining us today a quick video that Mavis created. Just to kind of show you a little bit of a taste of what respiratory therapy is all about. The video does showcase some of our students doing some procedures in our classroom. So if you know some things about it already, this would be informative for you. And if you don't know anything, this would definitely be very helpful. So I'll let Mavis go ahead and share our video.
All right, pull this up.
Just want to make sure you share your computer sound as well.
So, can y'all hear me?
Yes.
Okay, so this just showcases different aspects of what you get to do as a respiratory therapist, different skills that you get to do. So here we're demonstrating intubation, which is something that respiratory therapist is involved with. So putting in breathing tubes. If you've ever heard of anybody on a ventilator, they have a breathing tube. And as respiratory, you get to be kind of in charge of that, managing the breathing tube. You can see here, one of our students is securing that device. We're bagging, we're gonna listen to breath sounds and assess our patients. And then we also get to be in charge of the mechanical ventilator, which is a big thing we've learned about with COVID right now. It's a nice life-saving and support device, a machine that delivers breaths to patients that can't breathe on their own. And as RTs, you are kind of the first frontline person that's going to be dealing with the ventilator and managing all of the different settings and different maneuvers we get to do with that device. So you can see our student here is kind of playing around with the ventilator settings. What's nice about our lab is we have simulators that allow you to, intubate, and we have ventilators that we can play around with. Here we have a student demonstrating CPT therapy or chest percussive therapy. We kind of vibrate secretions out of the lungs. So we deal with critical patients and patients in more acute care settings. This is a patient with a different type of airway, which is called a tracheostomy tube. So we manage all different types of airways and do kind of oxygen therapy and assessment with them. Aerosol therapies or breathing treatments, with a lot of people are familiar with. Other kind of therapies and diagnostics, like this is an IS that we have a student working with right now, helps to open up the lungs, and we work with patient education and kind of get to really interact with our patients and talk to them and make them feel better. And this is another aspect of airway management with suctioning. So we get to do a lot of, you can see a variety of different skills. It's very hands-on, very patient interactive. And what's great about our program is we have tons of hands-on learning experiences, both in our labs on campus. And then once we master those skills, we send our students off into the hospitals to demonstrate those on real patients in that hospital setting. We also are involved in certain labs. This is one we call an arterial blood gas. So it's not just all airway stuff. We do deal with a little bit outside of that scope, which is this lab sampling as well. And then so it's really just a large variety of different patient care and support therapies. Some are more invasive, like that arterial blood gas monitoring, and some are more simple, like this nasal cannula, which a lot of us has seen maybe like in the grocery store, there's, generally an old lady on a nasal cannula. And it's also very interdisciplinary. We're going to work with not only RTs, but doctors and nurses. We're involved in code situations like this, or just kind of simple situations on the floor. So what's great about respiratory is we're kind of all over the place in a lot of different areas of patient care and a lot of different areas of the hospital. So we are both kind of in the ICUs on the floors and sometimes even outpatient. So a lot of different options for respiratory as a career.
So I see we have someone who's in the meeting with us, Miss Michelle Peters. I don't mean to call you out, but I see your name there. So to start, before we get too involved in it, do you have any specific questions about the field or our program that might be something someone at home has a question about as well? It's okay if you don't.
I don't have anything more see that respiratory the respiratory therapist program offers. I'll be starting in the fall. So I'm just kind of trying to get to every Zoom that I can to get more information so I know if I want to go to this program or if I want to go to that program.
Wonderful. Well, that's good to do your homework and ahead of time, so you know exactly what you're getting yourselves into. Well, we'll go ahead and talk a little bit about our program. And if you come up with any questions, feel free to type them in the chat or interrupt us. So our program is going to be an actual 24-month program, and that's after you do some of the prerequisite courses. The prerequisite courses do take about 3 semesters. You have to take biology, anatomy, and physiology, which the anatomy and physiology is intimidating to some people, but it's very important for you to truly understand what is going on in a normal human body. So you can definitely have an understanding of how a diseased person, such as a person with cystic fibrosis or asthma, is affected and how to go about best treating them. So the prerequisites, again, take about 3 semesters. And then once you get through those, the program is actually 24 months. It's 6 semesters, but that includes the summers. So it's a fall, spring, summer, and then another fall, spring, summer, which is a very long time commitment. But once you're done with it, it is definitely worth it. We have tons of job opportunities out there for respiratory therapists. I actually was looking up some statistics yesterday. The projected growth for our field of respiratory therapy over the next 10 years is a 19% increase. I believe the labor statistics, so there's 185,000 jobs available right now for RTs nationwide. So it's a long commitment, but you'll definitely be able to have a great job whenever you're done. Respiratory therapists do make really good money. I think the average salary, now this would not be for a new graduate, but the average salary is about $28 an hour right now. So a new grad may start out a little bit less than that, but not much less than that. So you can definitely make a nice living. And the nice thing about respiratory that a lot of people don't know, the video showed a lot of the different skills that we do, is that we are at the bedside 24 hours a day with the patient. A lot of the other allied health fields may not be totally involved in patient care 24/7. It's no offense to some of them other fields, but some of the other fields don't, necessarily work with the patients daily, on the weekends, at night, like we do. When you go into the intensive care unit, it's basically the nurse and the respiratory therapist at the patient's bedside all the time. So it is definitely a very patient heavy field. Like Mavis said, we have tons and tons of patient involvement, and there are definitely many different avenues that you can take as far as for that patient involvement, meaning you don't necessarily always have to work in the hospital taking care of a patient who's in the ICU. We also have a diagnostic side of the coin, I like to say, in respiratory, where we do more diagnostic testing, like pulmonary function testing, and that helps us to determine what the patient's actual disease is. We have rehab, where once patients are diagnosed with a respiratory disease, a lot of them will undergo pulmonary rehab to try to help improve their quality of life. So there are definitely different avenues besides just working in the hospital per se in the inpatient setting. The other good thing is respiratory therapists are needed across all patient populations. We work in nursing homes, we work in neonatal intensive care units. We're all over the place. So there's definitely lots of different prospects of what type of patient population you could work with as well. So I don't know, Mavis, do you have anything else that you would input?
I don't know. So about the program itself, it's a nice mix. We have a lot of in-classroom experiences. We have lab components. We are in the hospitals, and most of our students, so from a clinical standpoint, which is kind of my area of expertise, we do clinicals throughout 5 of those 6 semesters that you are enrolled in the program. And most students, we rotate around a lot of different hospitals in the area, not just in New Orleans, but in the metropolitan area as well. So we get exposure to, all of our students get exposure to a lot of the different sites, and are often either asked to work at a facility before graduation, or they know where they want to go. So you basically come out of the program with jobs, or a job in mind, and exposure in relationships with a lot of those hospitals already. So it's really nice for our graduates that we're always kind of working towards that end goal of employment at the time of graduation.
Yes, that is definitely some good points about our program. We definitely have great variety. As far as for the actual program, some questions that a lot of people ask, it is basically, we want to say a full-time commitment. We do have students who work while they're in the program. Of course, if you don't have to work, that's always for the best, but we understand that people have bills and families that they have to take care of. So we do have kind of set schedules. Most of our classes we try to do face-to-face. Of course, the pandemic kind of changed all of that, but we are slowly migrating back to face-to-face courses. We do have the capability to offer some virtual learning, but we do find that our students tend to prefer face-to-face learning. And there are some skills, like you saw in the video, that you really just can't teach you how to stick for blood draws in a virtual setting. It's not as easy as you would think. So most of our classes are Monday through Friday, usually during the normal daytime hours, 8 a.m. to 3:30 is pretty much the latest we go. The clinicals generally are day shift clinicals, so they would usually begin as early as 6 a.m., maybe go as late as 4 p.m., but it's usually an 8-hour clinical day. So we don't really do any evening classes or night classes at this time, but that does allow the students to have their evenings and nights to either work or be with their families. Nikki, are there any other suggestions or questions that you might have about our program?
Yeah, I've learned, I'll always love listening to program information. It definitely gives me more insight into the, what the program entails, so to speak. Yeah, don't have any questions on Facebook right now. Michelle, I'm not sure if you have any other questions now that you've heard some more information.
No, I don't have any more. It was great.
All right, awesome.
Thank you.
Thank you so much for joining us today. For those of you who are watching us on Facebook, thank you so much. It will be, video will be archived here, so you can always share it with your friends later. Renee and Mavis, thank you so much for presenting today. I really appreciate it, and all the fantastic information you gave us about the program. And today wraps up for Community College Week for today. We have tomorrow and Friday, we have a set of events for the Writing Center, Business and Technology, as well as Biotech and Chemtech. So if any of y'all are interested in that, please feel free to still register on our website to get the Zoom link where you can join in for those meetings. We also have a preview day on Saturday that's just going to cover all of our programs and everything that we offer at Delgado. So you can check that out on our website. I hope everyone has an awesome day.
Thank you for having us.
Thanks.
Thank you.